We'll be discussing some of the tips to be safe at home if you have Parkinson's. You know, safety is the most important thing. I am Dr. Anna, neurologist from Parkinson's Clinic in Scarborough, Toronto. So the safety at home may be relevant to bathroom safety, kitchen safety, staircase, and other places. In the washrooms, you should have the handlebars close to the commode or in the shower so that if you need to hold on to it to stand up, it's helpful. You can ask a occupational therapist, or your family physician can make a referral. They can come and assess your home for safety, and following their advice is very helpful. You should have a stick-on mat in the bathtub. The adhesive bathtub mats, they avoid slipping in the bathtub. Also, when you finish having a bowel movement or urinating or have a warm shower, sometimes your blood pressure decreases. When you stand up quickly, you may feel dizzy. So be especially careful in these situations. Keep your feet apart at a good distance so that your balance is in good shape. Also, the doors of the washroom should be big enough so that if you need to take a walker to the washroom, the walker can easily go. Also, don't lock the washroom door from inside. God forbid if you fall, then your family member or someone can get into the washroom easily and they can help you to stand up. Also, take special precautions. Avoid hitting your head or other parts of the body to the edges of the countertops because they can cause a lot of problem. For shower, you can have shower chair or a bathtub and always take a shower while sitting rather than standing. Make sure the floor of the washroom is not slippery when you go to the washroom. If you wear socks, then there are certain socks which have a stick-on things at the bottom. They are helpful to avoid falls. With respect to kitchen safety, patients with Parkinson's may have tremor, although the tremor in the beginning is only at rest. But as the disease progresses, you might have a tremor which is apparent when you are using your hands. So if you are using a knife to cut food or do other things, the knife may start shaking. So be especially careful. Always ask for help. If you're trying to fry something using a fry pan, so you are holding a handle, it might shake. Similarly, if you're holding a cup, you might have a spill of a warm or hot liquid. So be very careful. So always ask other people to do so. And also if you're cutting fruits and vegetables, sometime with the knife, if your tremor is not controlled, you can have accidents. So keeping the handle of the fry pan towards the back burner of the oven is always helpful. In case accidentally or because of tremor you hit the handle and you may spill the oil or liquid, whatever you are trying to do with the fry pan. Avoid edges of the countertops as in case of washrooms. Make sure the floor of the kitchen is not wet. With respect to the staircase, you should always go slowly. You should hold on to the bars and make sure you don't miss a step, because if you miss a step or trip over, you will fall. In some patients roll over the flight of stairs. They can get fractures of various body parts. Sometimes patients get the fractures in their spine that can cause a lot of injuries. Patients can get paralyzed. So it's very important to avoid falls in those conditions. If you have the steps at the door of the house, so you should have a bar. You can grab the bar when you are going inside or coming out of the house. Also, having a rubber treads on the stairs is helpful. You should always watch your speed. You don't have to rush. So take your time, do things slowly. Also, when you stand up slowly, take time before you stand up. If you are supine or lying down, sit on the edge of the bed for some time, then stand up, and make sure you have enough time to stable yourself before you start walking. Also, try not to stand at one place for a bigger time, and keep a distance between your feet. Safety is very important when it comes to Parkinson's. God forbid, if you have a fall and you hit your head and you have bleeding or some injury, you have to go to hospital, and you might need surgery or other procedure. To stay out of hospital, you have to avoid falls.